Okay.
Hi, Dr. Dan Maddock here once again. This is for doctors that are in states where you're not allowed to go inside the mouth or inside any orifice in the body, but you want to correct a temporomandibular joint problem. What I recommend is this. Suppose we have a right-sided temporomandibular joint problem. What I want to do is to just grab the jaw like this and traction down, open your jaw a little bit, relax it. There's a little pop right there. And we're just going to stretch this temporalis muscle all the way along its border, lifting up on the frontal and the parietal, and kind of cross-fibering and trigger pointing along that temporalis muscle and down here into the masseter muscle like this, and just release all that muscular tension in there. This is Dr. Tuttle, or soon to be Dr. Tuttle, and he has agreed to allow us to do this to him today. Now, I'm going to use this kind of a contact, and I'm going to come in on the posterior angle of the ramus, and I'm going to come in on the anterior border of the mastoid process. And I'm going to stretch gently, and I'm going to ask Dr. Tuttle to slowly and gently turn his head to the right. And I'm separating. As he's turning to the right, I'm pulling posteriorward on the mastoid process and anterior on the posterior ramus of the mandible. How does that feel? He likes it. Also, the palm heel of my hand is on the anterior inferior margin of the ramus of the mandible just to help me. Now turn to the left and turn to the right. Now in iso-cranial technique, one hand works with the motion of the patient while the other works in opposition to try and gently and equalize and normalize the motion between the doctor and the patient. Isometric means motion or exertion without motion. So turn your head to the left. See, I'm trying to balance it out. Now turn back to the right and back to the left. And this stretches out the stylomandibular ligament. Turn this way. And we do the same thing on the other side. Open for me and stretch. Stretch. Come a little closer so they can see this from above. Stretch, that's good. Stretch, stretch. Now grab the inferior margin of the zygoma and stretch the masseter. That's it. Now, grab here the posterior ramus of the mandible with your right hand and the anterior portion of the mastoid process, and have the patient take a deep breath and turn to the left. Gently stretching. Keep turning as you breathe out and relax. Now turn to the right and back to the left and relax. Now you can take stabilizing grasp on the frontal maxillary and malar bones right here. Open for me. Now turn your head gently to the right, slowly, and you're going to move the mandible to the left and relax. One more time, turn to the right and relax. And now I'm going to reverse, grasping the facial bones, and relax your jaw. Turn your head to the right. Let go of the jaw, let it come this way, thank you. And back to the left, and back to the right. Let your jaw go, and back to the left. That's good. Now, underneath here is the digastricus, which comes down the posterior belly, innervated by the 7th cranial nerve, comes down and loops through the hyoid bone and comes up to the anterior. Now we can come in and just kind of gently massage that muscle a little bit under here, but another thing we can do is to come here and grasp the hyoid bone and just gently traction down and have the patient turn your head to the left and traction the hyoid to the right. Feel it move?
Mm-hmm.
And go back to the left. Gently, relax, let me get a hold of it here. There we go, and turn to the left, turn to the right, and to the left, and to the right, and stretch, and relax. Okay.